This is Scott Becker with the Becker Private Equity Podcast, and thank you for listening today. This is going to be about 13 trends that we're watching in healthcare currently. We'll also post this on Becker's Healthcare, and thank you for listening. I'll start off with 4 big problems in healthcare, then talk about 9 other trends that we're watching. The first one is that healthcare, as we say, often has a numbers problem, a math problem. There's about 1,060,000 physicians, about 330 million to 340 million people. We only produce about 18,000 or so physicians a year. We need probably a couple 100,000 to fill the gap we need in physicians. We are so far away from this, it's getting scary. From an access health equity standpoint, this is very, very challenging. We've also got more physicians than ever retiring and going part-time. And the problem is both specialists and primary care physicians. It's really both. Second, healthcare is what we think of as a power problem. There's 4 massive payers amongst the 20 largest companies in the U.S. by revenues. Those include United, Aetna, Cigna, Elevance. Then there's also Humana and Centene. 2 of those companies, United and CVS, are the 5th and 6th largest companies in the U.S. by revenues at 370 billion in revenues. In contrast, the big healthcare systems, the big physician groups are infinitesimally smaller compared to that. The largest health systems really are 30 to 35 billion, and they're often spread out. So the difference in power in these dynamics and partnerships is really, really significant. The third thing we often say is that healthcare is a thinking problem. Meaning at the end of the day, solving healthcare is not going to be just technology. It's not going to be just people. It's going to be some mix of both, that we both need to really enhance technology, but we also need to really enhance the people and the labor pool for healthcare. We're going to end up with horrendous challenges in access and in equity. Fourth, one of the things that's often said is if we just change the payment system, this will fix everything. One of the things I think is, and we say this, it's not the payment system, stupid. And that's an old riff on the James Carville line. It's not the economy, stupid. But the reality is, if you have fee-for-service or value-based care, there's abuses on both sides of that. The reality is, like, here's supply and demand, simple economics problem. We don't have enough healthcare workers, providers, physicians to take care of all of us. If you really want to look at solving different the healthcare problem, it's not the payment. There's problems on both sides. Whichever payment system you use, there are problems. Technology, therapeutics, labor, greater efficiency, those will all help. A shout out to the weight loss drug companies. There is a concept. If all of us lost 10 pounds, this would probably go a long way towards reducing pressure on heart disease, diabetes, cancer, dementia, joints, all these things, and that would probably have an impact on healthcare costs and the healthcare situation we have. But it's not the payment system. It's so many other things that have to be improved, and there's problems regardless of what payment system you use. A fifth issue, and this sort of talks again to none of doctors. Recently, you've seen CVS, Walmart, Walgreens all retreat from the healthcare business. And for any of us who have been watching this for years, and this should resonate with real estate people, a lot of those sites were built out as health hubs and for doctors for years now, but at the end of the day, there's just not enough doctors to staff all those things. So you're seeing these big, big firms retreat from that, even though they had planned it as part of what they wanted to do. A sixth issue that we're watching is government health care. Between Medicare and Medicaid, it's now 50% plus of all health care delivered. Many different thoughts from that. It used to be that commercial payers subsidize the rest of healthcare. That's no longer really available or in very small doses. That's its own challenge and issue. You saw the campaign signs, you see the campaign signs periodically, get the government out of my healthcare, get the government out of my Medicare, and it's almost a ludicrous sign because we've already crossed a transom that more than 50% of all healthcare is through the government, through Medicare and Medicaid. Seventh issue, we're watching Medicare Advantage. This is now more than 50% of the Medicare program. It used to be the fee-for-service dominated. What we found so far is satisfaction's not so great. It costs more. For a while, the payers were cleaning up on it. Now, as Medicare has softened the rate increases on it, it's getting tougher for the payers. It's not as profitable as it was. And lots of hospital payer dissension over the Medicare Advantage program. Eighth issue we follow, again, and we talked about this earlier, technology helps, but it's not the be-all and end-all. It's not the panacea to everything. In many places, technology supplements physicians, helps leverage the healthcare workforce. At some point, we need to go further to where it actually handles healthcare problems, but we're not really there yet, and we still very much need people as part of the system. The ninth issue, and we talk about this again, we talked about it earlier, value-based care is not the cure-all for everything. And many times it meant sort of rationing healthcare. When it rations, the payers get rich, the rest of us don't get care. The real truth on payment systems, it's not the payment system, it's the supply and demand issues we're really facing. 10th, and we talk about this often, behavioral health is just a debacle. Just not enough psychiatrists, psychologists, and all kinds of providers of mental health and allied health practitioners there. 11th, private equity is not itself the problem. People talk about private equity. It's very easy to demonize from a DC perspective, but it's really a problem on the edges versus the core of healthcare. Yes, you periodically have these blowups like Steward Healthcare, which had too much leverage in a lower margin business that it impacted them, Medical Properties Trust, and more so. But at the end of the day, that's not really the core problem. Private equity, it's a small percentage of total physicians they control, but it's an easy thing for DC to demonize. 12th, and we talk about this often, it's unpopular, but weight loss would help us a great deal as a country. Again, we talk about this. If everybody lost 10 pounds, cardio, diabetes, joints, dementia, cancers would probably all flow in the right direction versus the wrong direction. That's why there's so much hope for these weight loss drugs, and we'll see how that all goes. Finally, 13th, hospital margins are improving, but there's a huge difference from market to market and between the haves and the have-nots. You see the haves building, staffing well, technology well, new programs, building new cancer hospitals, new cardiovascular programs, orthopedic hospitals. You see have-nots barely trying to keep it going. And you see that sort of in rural markets, urban markets, all over the place. Small hospitals, independent hospitals really struggling. Big systems rebounding well. In any event, those are 13 of the trends we're following at Becker Private Equity Business Podcast, 13 Healthcare Trends. Thank you for listening to the Becker Private Equity Business Podcast.